At Jones, we have more than 10 years of experience getting media coverage for healthcare IT organizations. We also understand enterprise software, and we know how to reach healthcare IT decision makers. I would love the opportunity to talk with you about how we can help you increase thought leadership and news coverage in your target publications. Now, not only do we have experience in this space, but we also know the journalists who are covering your space. I recently emailed you a list of some of our favorite journalists. If you missed it, you can download it here. There's a link in my email below. Just click the link and you'll be able to download the list. I'd also like to take it just a minute to share a quick case study with you. We've worked with West, which is a healthcare IT client, for more than a decade. And during that time, we've been leveraging surveys to drive thought leadership coverage for the company. And honestly, it works great. As you can see here, we've secured literally hundreds of pieces of coverage for West. Let me just tell you a bit about how we were able to do that. The strategy was to leverage the survey data to deliver a series of what we call insights and impact reports. Now, we've created more than 20 reports for West, but this particular report focused on the need to improve chronic care. And it addresses the fact that patients, they simply need more help managing their chronic conditions. Now, what we did is we released this report at HIMSS. So here's an example of the report, and this was just a quick media handout we had at HIMSS to hand out to media at the booth, also for sales to hand out to prospects. But with this single report and the corresponding survey findings, we were in this just one announcement, we were able to secure 23 pieces of media coverage for West, of course, in conjunction with HIMSS and the news. And one of the great things about survey data is that you can slice it and dice it and pitch different angles to each publication. For example, you can see here that Healthcare Finance, for example, was able to pull a finance-related article with data and tie it to fewer readmission penalties. Managed Healthcare Executive, on the other hand, they turned it into more of a what you need to do article. And then, of course, Health IT and CIO Review, that publication zeroed in on demand for two-way biometric monitoring. Now, on the next slide here, you can see that mHealth Intelligence, of course, they took a mobile angle. And of course, we always love to see our survey findings getting picked up by USA Today snapshots. So again, that's just one example of how we leverage the survey data to issue a single announcement and garner coverage. The key point here, though, is that slicing and dicing that survey data to provide a unique angle to each different publication is really important to driving more coverage. But it's also, I want to point out that this survey was just this announcement was just a component of the survey. It didn't have all of the survey data. It just had the survey data related to chronic care. And so, one survey repeating this process that I just walked through time and time again, it was what helped us get that coverage up into the hundreds. So repeating that approach is key. And not only that, but marketing and sales, they can use the survey data too, and they can use it to drive leads, close deals, but that's a conversation for another day. I would truly enjoy the opportunity to connect live. I'd like to learn more about you, your program. Perhaps there's an opportunity to work together. Of course, you can ask me questions about surveys or anything else related to PR and marketing. At the end of this video here in just a moment, there'll be a button that you can click to book some time on my calendar. Go ahead and click that button, pick a time that works for you, and we can connect live and chat. Alternately, if it's easier, there's a link in my email to my calendar, so go ahead, click that link and get some time scheduled. I look forward to connecting. Talk soon. Take care.